Hello, and welcome to our deep dive into safeguarding in the UK. Today, we're going to break down what it means, who it protects, and the roles we all play in keeping people safe. So let's get started. First up, what exactly is safeguarding? Put simply, it's the process of protecting a person's health, well-being, and human rights, allowing them to live free from harm, abuse, and neglect. It's a collective responsibility, ensuring that vulnerable groups like children, young people, and adults at risk are kept safe. This is all guided by a few key principles. Let's look at three of them. First is empowerment. This means supporting people to make their own decisions and give informed consent. In practice, this could be a healthcare professional fully explaining a treatment's risks and benefits, so the patient can make their own choice. It's about respecting their voice and right to control their own life. Second is prevention. It's always better to take action before harm occurs. This principle is all about being proactive. Think of things like staff training, clear policies, and thorough recruitment practices. These are all obstacles put in place to stop abuse before it can even start. And third is protection. This is about providing direct support to those in need and stepping in to stop harm. Examples include conducting risk assessments to identify potential dangers, running background checks on people working with vulnerable groups, and maintaining detailed records to track any concerns. So, who are we talking about when we say vulnerable groups? Let's take three examples. Children and young people are vulnerable because of their age and dependency. They might not recognize danger or have the confidence to speak up. This makes them susceptible to harm from adults or even their peers. Next, adults with learning disabilities. They might struggle to understand complex situations or communicate that they're being mistreated. Their reliance on others can increase their risk of abuse, especially if proper safeguards aren't in place. And finally, elderly people. Physical frailty, social isolation, or cognitive decline can make them vulnerable. This can lead to financial exploitation, neglect in care homes, or emotional abuse, particularly if they can't advocate for themselves. Now, let's define the term abuse. Abuse is treating someone with cruelty or violence repeatedly. It can be physical, emotional, neglect, or sexual. One type is physical abuse. This is any act causing physical harm, like hitting or rough handling. An indicator could be unexplained bruises or a person flinching away from touch. Emotional abuse is the continual emotional mistreatment of a person. It can involve scaring, humiliating, or isolating someone to control them. Signs often include low self-esteem, anxiety, or a sudden withdrawal from social activities. Then there's sexual abuse. This is any sexual act without consent. It can be physical contact like rape, or non-contact acts like forcing someone to look at sexual images. Indicators can be physical, like bruising in intimate areas, or behavioral, such as a sudden fear of a specific person or place. To enforce all of this, we have key legislation. The Sexual Offenses Act 2003 updated the law, clearly defining consent and creating new offenses to protect vulnerable people, especially children. The CARE Act 2014 places a legal duty on local authorities to safeguard adults at risk. It mandates investigations into abuse concerns and champions the idea of making safeguarding personal, involving individuals in their own protection plans. And the General Data Protection Regulation, or GDPR, from 2018 gives people more control over their personal data, ensuring organizations handle it securely and responsibly. So who's responsible? It's a team effort. Local authorities work with housing, police, and community groups to coordinate safeguarding. Social workers investigate concerns of harm or neglect, promoting the rights and well-being of individuals and families. And in every organization, there's a designated safeguarding lead, or DSL. This person is the expert managing referrals, advising staff, and ensuring all policies are followed. But these complex networks can sometimes create barriers. Imagine a child known to both their school and a doctor. If these professionals don't communicate effectively, perhaps due to data protection worries, the child could fall through the cracks. To fix this, we need to improve multi-agency communication with clear rules for sharing information. We also need to clarify roles so everyone knows who is responsible for what. And finally, safeguarding must be embedded in every organization's culture, from the top down. For those in key roles, like a DSL, specialized training is available. Level 3 safeguarding training equips them with advanced skills to manage concerns, and they can access resources from their local safeguarding partnership to stay up to date with best practices. Safeguarding is a vital part of a caring society. By understanding its principles and our roles, we can all contribute to creating a safer environment for everyone. Thanks for watching, and don't forget to like and subscribe for more content.